Hi, my name is Dr. Jane Dryden, and I teach here in the philosophy department at Mount Allison. So one of the areas that I work on is philosophy of disability, and so I thought I'd tell you a little bit about one concept, or actually two concepts, that you might encounter in something like philosophy of disability. So first is the social model. And I want to say that's not unique to philosophy. You would encounter the social model in disability activism, but also we have a sociology of disability course, or if you took the disability and political science course as well, you would definitely be introduced to the social model in those courses. It's really big. The insight of the social model is this. Instead of being a biomedical issue or problem that's specifically faced by an individual and that's up to doctors as experts to cure or fix, the social model says actually disability is two things. One is impairment. Impairment is the neurological or anatomical or biological difference from the norm, right? So just some sort of difference. And disability is what's created in the relationship between that difference and the environment as a whole. So the social model really looks at that relationship. So for example, I have a visual impairment, right? My eyes work a little bit different from the norm, but with glasses, I don't really encounter any obstacles, and so I wouldn't really be said to have a disability. One of the things the social model then also points out is that, for example, a wheelchair user, in a context where there's lots of ramps and they can get around, they're not really disabled even though they have an impairment because they can get around, because their environment is accessible. If they're in an environment that has very few ramps or just expects stairs or has very narrow doorways, then that obstacle, that starts to be, then we might say that they're disabled by that environment. So that's the social model, and it's been really, really useful in policy and advocacy because it says, look, we can work at creating a more accessible world, a world in which, of course, there's still impairments, but in which there's less disability, right? There's less of that obstruction or obstacle. So that's really great, and that's the social model. But one of the things that's developed as well in philosophy is a sort of more relativist or historicist account of disability, in which we look at the history of what has counted as a disability in the first place, or what has even counted as an impairment in the first place. And here we can see that there's not a super neat distinction of impairment as this purely biological thing over here, and disability as this relational thing. But what even counts as a difference that matters as an impairment is already social and cultural and historical. So for example, we've frequently seen, if someone is much shorter than the norm, we might count that as a disability. We might talk about a person with dwarfism or a little person, but we don't really often tend to talk about excessive height as a disability, right? Tallness is not usually seen as an impairment, even though it's also a difference. When we want to know what sorts of things count as impairments, we need to tell more of a historical story. We need to see a development of how that has started to look like an impairment. And usually it's because it's interfered with productivity, right? It's interfered with certain expectations of what people should look like. So for example, in a number of places, there have been in the past things called ugly laws, right? About people with certain disfigurements who were then not allowed to be out in public because there was a strong emphasis on what a normal society should be like. Right? And unless we look at that bigger story, we're not going to really understand what counts as disability because it's not this nice, neat distinction. And so this historicist account encourages us to look at some of the details of disability better. And it also really encourages us to ask, well, what should be normal anyway? And couldn't there be lots of different sorts of ways to get around? Shouldn't there be lots of different ways of being useful or productive? Or can we even challenge the ideas of useful and productive in the first place? So this is going to be really important, segueing back to the current day. This is going to be really important as we think about a world recovering from or moving through this COVID pandemic. We're starting to see people with damage in their lungs, damage in their hearts, lots of long-lasting fatigue, right, as we see these long-haul COVID symptoms. And so this is going to be an increase in disabled people. So we really need to take this moment seriously as a chance to rethink what it is to share a world together and what we expect from each other. What levels of energy are we expecting from each other? What levels of productivity are we expecting from each other? What kinds of use do we expect humans to be? Are there better ways of finding value in each other than just use or productivity? So I think this is a really good chance to reimagine a world that's accessible and open and just for everyone. So I hope that was reasonably interesting. Welcome to Sackville. Welcome to Mount Allison.